Good morning, everyone. Welcome to our Facebook Live. It is Mental Health Awareness Month. It is May, and we're talking all about postpartum depression. I am a blogger and influencer on TaylorWalkerFit.com, and I am a new mother, and I am joined by two fabulous guests today. We have Dr. Alejandra Salazar. She's an OBGYN here at Baptist Health, and we have Grace Jimenez, and she's a behavioral health manager here at Baptist Health. And I have a stat here that I really want to jumpstart the topic today. The ACOG, the American College of Obstetrics and Gynecology, says that the baby blues or perinatal depression affects 1 in 7 women. Now, that kind of astounded me, especially just coming out, having my child, and I'm just getting over that hump. Can we just talk about what is perinatal depression?
Definitely. So perinatal depression is basically symptoms of depression that you feel right before or after the immediate postpartum period. Postpartum depression can be throughout the first year after you deliver, and it can actually become chronic depression. It can last years, it can last, forever. So we have to be really careful and try to discover the symptoms and try to manage them as soon as possible so we can help the mother. What's scarier about that statistic is not only is it 1 in 7 women, but of the people who have postpartum depression, only 10% of those women do tell something to a health practitioner.
Only 10%?
Mm-hmm. So that's why we have to screen them in the postpartum period and in the perinatal period, so we can know that they have symptoms and we can help them before they have the baby and after.
Right, and I think that is such an important thing, just talking about it, because
Exactly.
I think so many of these symptoms we assume are normal,
Right.
right? We normalize, sadness or weepiness, but for how long? Can we do that? So perinatal depression, I didn't realize this, it can actually start with the baby in utero. What are some signs to look out for when you are pregnant?
So some of the things that you're going to look for is some of the regular signs for depression. So you'll feel tired, you'll not want to get up and do things. Some of it, yes, of course you're pregnant, so your body's changing and there's a lot of different things going on. But then there's a little bit more. It's happening more on a regular basis, and you just don't feel right. It's not that you feel sick, that's going to happen, but you just don't feel right. So you're tired more, you don't have energy, you don't want to do the things that you enjoy doing. So a lot of that is happening. And then there's some of the sad thoughts that come in, and you start judging yourself, and there's a little bit of guilt because I'm pregnant and this is a great time. At least that's what we tell all moms, right? You're going to have a baby and this is a wonderful thing. So be happy and be excited, and then you don't feel that way because you don't feel good. And those are some of the signs that something else might be happening. And so making sure that you're talking to someone else about the signs and what's going on with you and what you're feeling, so that you can rule it out, because it may not be something, it might be something physiological.
Correct.
And that's one of the first things we want to do is rule that out, that it's not something physiological, or that it is, so that we can get you the kind of help you need.
And that is important, because I feel like when you are pregnant, you go and you see your OB, and it's more just about your physicality and checking the baby, but I don't think I really checked in on how I was feeling mentally. I did have, thankfully a nice pregnancy, but there were moments of, I was unsure and a little scared and nervous, especially toward the end. So if you do have a history of depression or mental illness, should you come out and say something earlier in
Definitely.
the pregnancy?
You should be screened since the first visit. If you have history of mental illness, if you have history of depression, history of anxiety, especially because a lot of women who do, they just stop taking their medications because they're scared to hurt the baby and stuff like that. So you should disclose that at the first visit. And yeah, you're right. So at the end of the pregnancy, it becomes like a 5-minute visit, right? It's like, oh, let me check on the baby, do you have heart tones, and bye. And that's it. So take that time, and instead, if your doctor doesn't ask you, be like, hey, can I ask you a question? Is it normal for me to feel this way? And I always tell my patients, it's like, how you feel at the beginning of the pregnancy where everything's different and you feel like you're crazy and you feel like everything is out of control. The end is kind of the same, right? There are so many hormonal changes and you're getting ready for the baby, but you're so tired of being pregnant and you want this to be over, but you don't want it to be over because you don't feel ready for the baby. So it's normal to be very stressed out. But if it gets over that, if it gets too overwhelming, then that's a problem, and we need to talk about that.
And one of the things that I'll add is that sometimes we don't know when is too over, when
Right.
is it too much, and that's when you should really start asking, and is this normal? I love that you asked that. Is this normal? Should I feel okay? Is there something else that am I feeling off? Do I need to do something else? And so I think you have to remember that as much as you're the mom and you're pregnant, but you're not the expert. Right? So ask your doctor, ask someone else, because they're the experts. They do this all day long. So you want to bring it up and say, is this normal? Just like you would ask your plumber, is it normal that it makes that sound? You're not a plumber, so is it normal? And that's what you're doing. You have to ask those around you, whomever it is. And so there's different ways that you can reach out and ask, and that's important.
Absolutely. And I think, in our country right now, women, when we have babies, it's like all of your focus goes there. Yeah. You get pregnant and all of your focus goes here, and you forget that you're an actual human being.
Exactly.
And then the baby comes out, and who's mothering mommy?
Right.
So it's definitely important. Maybe have that go-to person in your life that says, I need you to check in with me afterwards and, be there. And if you notice a bigger change, maybe I need to get some help.
Exactly.
If I share a personal story, I wasn't expecting the anxiety piece. I've never had a history with anxiety or depression. My birth was great, but afterwards I felt a flood of emotions that I've never felt before. It was unrest. It was trying to be everything to everyone, and that can really break a person. I know I broke down into tears multiple times. So when does the anxiety start to kick in, and is that normal?
It's completely normal. I mean, a lot of it has to do with the changes in hormones. So your estrogen and progesterone just drop significantly right after you have the baby. So from day 1 to 3 to the first 2 weeks, what we call the baby blues, they're completely normal. So all of those changes, a little bit of depression symptoms, a lot of anxiety, because you're a new mom. If you're a first-time mom, you don't know what to do. You don't know why your baby's crying. You don't know if your baby's sleeping okay. So the lack of sleep, the constant worry, the fact that you have to breastfeed and there's not enough milk coming out, the fact that you have to take care of your husband, the fact that you have to, do all these things can become so stressful. And you have to play all these roles in your family now. It's completely normal. But that should only last maybe for a couple weeks, right?
Yeah, that was my
until you get used to this new role, right? If you see that this is continuing and now you can't sleep when the baby's sleeping and you're having all these thoughts about the baby, or you are eating too much, or you're not eating, or you have this constant anxiety and it's not going away, it's only getting worse because now you're not sleeping at all, now you're more tired, now you're more anxious, then it's when it becomes a kind of like a roller coaster. And
right.
It's hard.
So would you say after that 2-week mark, maybe do a check-in, and then how long would you let those symptoms go? Because I know it took a little while for me, and I did have to discuss with my doctor, and we did a survey about all of my feelings, and she said, listen, you might be on the cusp, but you're going through a lot of change right now. I'm now bicoastal, which is hard with a newborn. So there were other things compounded there, but I had to ask myself, is this postpartum depression, anxiety, or is it just a transition in my life? And ultimately it came to a close, but is it that 2 weeks? Is it that 6-week appointment? When do you say, okay, I need some help here?
I think it depends on what you're going through in life. A lot of abrupt changes can be very difficult to deal with at that time. If you feel like you have a good support system and you can do well with therapy and you can do well with the family support that you have and everything, I would check in at the 6-week appointment and make sure that you're okay. However, if there are symptoms that are dangerous, meaning you want to harm yourself, you want to harm your baby, and listen, this happens, you shouldn't feel bad about it because this is a chemical reaction. Sometimes you are so tired that the baby crying is just too overwhelming for you. then that's when you need to look at yourself and be like, I need help. I need to go somewhere. I need to call someone. And as doctors, we can be there for you, but we can't be at home with you 24/7. So we need a little bit of help from you to look at yourself and be like, okay, I need more than just talking to somebody or to my doctor. I need therapy, I need medication, I need to be in the hospital. And that's okay, you know. You can eventually come off of medication, you can eventually go back to your normal life, but we need to catch it before you hurt yourself.
I would add that use your family, use the people around
exactly.
you. Have the conversation, help them track how often this is happening. If you can't shut your brain off, if you're constantly thinking about something, whatever it is, whether it's are you going to trip, are you going to hurt the baby accidentally, are you overwhelmed and there's something else going on and you're like, I would just wish this would stop. Those are the things that then you start talking and share it. It's normal to have these thoughts because there's so many different things happening. So how do we help you so that we can help decrease them and you can manage it? Because that's the point, is how do we help you manage this time period so that you can take care of yourself and then take care of your baby?
It is hard, though, for a lot of women to admit that they can't do it all.
Right.
I think that's, I think also in the social media generation that we're living in right now, it's the idealized perfection of being the perfect mother and wife. But we're only human, and I think those two powerful words, chemical reaction, it is, we don't think of it that way. We think about it as, oh, we're failing. And so if we do need to get therapy, who do we talk to if you think we really need more help than just...
So there's definitely speaking to your doctor. If you have an appointment already set up and you're going, or you can call in and come to see your doctor, then they can also help you, give you a list of people in the area, because a lot of doctors' offices will do that. But there's other opportunities. For Baptist, we have Care on Demand.
Yes.
And so Care on Demand it's a great tool, especially for new moms. The way I see it is it allows you to have a therapist, a mental health provider, right at home. So you don't have to get up, you don't have to get dressed, you don't have to wear makeup, you don't have to worry about taking the baby out. And I've talked to a lot of new moms, and a lot of times they're just about to head out. They've got the makeup, they finally are nice and dressed, everything's done, they're packed up, and then the baby has an accident and they poop, and then you have to start all over again. And so it becomes difficult when you're maneuvering with a newborn and everything around you. So using Care on Demand is a great opportunity to be able to have that support while you're at home, and the comfort of being safe at home will definitely help.
I mean, that's such a valuable resource because you'll save mothers hours, really.
Yes.
And that is the Care on Demand app that you guys can download. We actually have a code for you. If you're looking for mental health services, you can use the code SELFCARE. And another great thing, because I did want to hop into breastfeeding a little bit and that added pressure, there's also lactation consultants now, and you can use the code NursingMama. So MAMA for that, and you get, I believe it's $10 off? Yes, $10 off, Care on Demand app. So I think that is just a fantastic resource for anyone down here. And getting back to the socialized world, breast is best, right? That's what we hear, breast is best. But it also comes with a lot of anxiety.
Yes.
And I just ended my breastfeeding journey, and we made it to 9 months, and I'm still, I missed that year by, my goal was to get to a year, and I didn't make it. And, it's the pressure that we put on ourselves. How do you feel about today's society and the pressure to be perfect and breastfeed for as long as we can and, just do it perfectly with ease?
I just think it's funny because we went from a world where we started getting all these drugs and technology and all this stuff, and now we're trying to go back to natural ways of doing everything, and we're trying natural labor, no Pitocin, no epidural, exclusive breastfeeding and all this stuff. And it's great. It's good to do things the natural way, but this is why we have these things, okay? So feeding your baby formula is not the worst thing in the world, okay? If you breastfeed, that is great, and you do it for as long as you can, but sometimes, your body cannot do it. And that is not because of you. That is not because of your baby. Sometimes your anatomy is different. Sometimes you don't just produce the milk. And you can always supplement. It's really hard because moms, I've seen them crying like postpartum day 1 because they don't have any milk, and I just want to tell them like it's all right. For example, like I was born 26 weeks, and I was in the NICU for many, many months, and I was fed formula because my mom couldn't bring me milk every day. And I turned out okay. So it's
I'm
like
a formula myself. All good here.
So it's like, don't put so much pressure on yourself.
Right.
I mean, we made these things for a reason, right? We knew everybody could not breastfeed. So don't put so much pressure on yourselves to be perfect, guys. Like, things happen, and we have found solutions for it. So if you have to give formula, it's okay. If you breastfeed for 3 months, it's okay. If you breastfeed for a year, 9 months, it's okay. You know, you don't have to be breastfeeding for 2 years.
Right.
It's normal. That's all I have to say.
Yeah, exactly. Without getting, and you know, it is tough because I keep bringing up social media. Obviously, this is the space that I'm in, and I know we had spoken. There are, if you're not ready to share, I know there is a hashtag right now that is happening, and it's My Wish for Moms. So if you're not ready to kind of share your story, but you want to grow and find a little bit of community and a little bit of connection, you can utilize that hashtag My Wish for Moms, and it's been really beautiful to see these conversations. Because I think there's so much about this process that we don't talk about.
Of course.
Everyone sees the glossy
Right, everybody
side of
wants
things.
to talk about, oh, this is a wonderful thing, you're pregnant, you're gonna have a little baby, and they're so cute, and they're so loving, and you're gonna feel so great, and you're gonna have that instant connection, and you're gonna, and it doesn't happen that way, not for everyone. Does it happen for some people? Yes, but the majority of people struggle with it, and there is a lot that's happening. Your body's changing, your baby's changing, there's a lot of other things. You still have to pay your bills, you still have the car alarm that goes off, the dog still needs to be walked. So there's a lot of stuff that still happens, and we forget that sometimes, and then we add the added pressure of being the perfect mom that has, you know, the new techniques on how to breastfeed or how to carry your baby or how to wrap your baby, and it's a lot of pressure, and I think sometimes we forget that we just have to just be present, just be okay, have support, make sure to take care of yourself, spend some time with family members, just be present, and it'll all work out.
I mean, that makes me almost emotional because it does go so fast.
Yeah.
And, you know, I spent so much time, I think, in the early weeks trying to be perfect, you know, and trying to be what I thought I had to be. And I feel like I missed out on the first 3 or 4 months because it was like I felt like part of me was failing.
Right?
It's all a blur, and now I see this 9-month-old baby, and I'm like, how did we get here?
Yeah.
And I'm sleeping, and he's happy, and he's on formula, and all is good.
And of course, it's a blur because you're a little sleep deprived. Let's
lot.
be honest. There's a lot of sleep deprivation, and you know, sleep deprivation is the #1 way that we torture people. So imagine you're a new mom and you're sleep deprived, and you want to be perfect, you want everything great for your child, but you got to get some sleep, and you got to give yourself a break. It's not, you don't have to be perfect. As long as your baby is okay and you have a support system and you're doing the best that you can, it really will work out. And there will be people who are going to come over and love your baby while you get some sleep.
Trust me, anybody will volunteer to babysit.
Yes. True.
Yes.
We do have, this is actually a great question coming in, and it says, how do I tell my friends and loved ones that I may be experiencing postpartum depression?
So one of the things you can say is you can start it off by, I'm a little concerned about what I'm feeling. And so I just want to talk a little bit about, is this normal, or I'm having a little anxiety, I'm having some stress, I'm not quite sure what to do about it. You can start with that.
I agree. You can also say, you know, I'm feeling a little overwhelmed. I think I need help right now. You don't have to be, if you don't want to be specific, you could be like, I could use some help taking care of the baby. Maybe I think I need to sleep a little bit more. Maybe today I want to do something for me, you know, and start doing a little bit more of the things you like and see how you feel. Or, you know, talk to your husband, your family, and say, I'm going to go see my doctor. I really don't feel great. I think there's something going on. And then once you go talk to your doctor, then sit down and say, okay, this is what's going on. I think I need a little bit of time. I need to either go to therapy or, I need to have a little bit of support from you guys.
Great. And I think too, because I did have a couple of people ask about the survey. What if your doctor says, okay, these are normal symptoms, or normal, quote unquote,
Right.
and then they don't administer the survey for you, or they don't see it, but you know that something underlying is happening, and then you don't feel right. Should you seek a therapist on your own?
Yes.
Okay.
Definitely. I would say if you're not feeling 100% and you know something's off, definitely seek a second opinion. Go out there, talk to somebody else. There's a lot of other moms that have felt like this, so you may be able to get a referral source from someone else. We talked about care on demand, that's always available. There are some other resources out there. There are some organizations like Postpartum Support International. And so there are other available opportunities. There's new mom groups around, and those are different ways that you can talk to other people and kind of get out there so that you can check your symptoms with someone else.
Yeah.
Just check in. And then you can start talking about, maybe it's time I go talk to someone and just take time for yourself.
Yep.
Think about it as this is an opportunity for you to take care of you so that you can do better for your baby.
Yes. Yeah. That's great. And we actually do have one here. If you go to baptisthealth.net/support groups, there is a parent support group that you can look at. You can check out here. And so another question we got, it says, will I get postpartum depression with a second baby if I had it with my first?
So it is a possibility that does happen, but you're going to let your doctor know from the beginning. That is the most important thing that you can do, is say, I had some baby blues, or I had some depression or some anxiety. I want to let you know so that the doctor can check on you regularly so that you can monitor those symptoms, and then you can take care of it sooner than later.
Right.
And same goes to you as the patient. Now that you know you had it, you know what the symptoms are, you know how you're feeling, and you know what to do, right? So it's maybe easier the second pregnancy, but the changes in your body are not going to disappear, right? So there's still a possibility of you having it, but I think you'll be able to manage better and seek help better if it happens the second time around.
Okay, great. And so next question says, a lot of us are putting together birth plans, and I think we had discussed this off camera, that sometimes if our birth plan doesn't go exactly according to plan, that brings with it a whole set of anxieties. But if I did have postpartum, let's say with my first, or if postpartum is something that I'm worried about because I have a history, is that something that should be part of my birth plan?
Definitely.
Okay.
Yeah, it's a contingency plan,
Right.
So if it's just like if you're driving in your car and you're taking a road trip, you don't want to use your first aid kit, but you got it back there just in case. So you want to have that in there. You want to have it in your birthing plan just in case this starts to show up. These are some of the things. These are the signs. What do I do? And so that you can let someone else know as well. You can let your husband know. You can let your loved ones know so that they can kind of monitor it with you. So it's not just on you whether or not this is happening.
Great. And what can you just explain, just for those of you who have hopped on to, what are like the main signs of postpartum or perinatal depression, which is when the baby's in utero, and then postpartum, like if you get past that 6 weeks and you're still feeling.
So you still want to look at some of the depressive symptoms. So those in general, the symptoms of being tired all the time, having some sadness, having some guilt feelings, not wanting to do the things that you enjoy doing, not wanting to spend time with your child, not wanting to do the sweet, fun things, feeling a little disconnected, having some difficulty concentrating. So those are some of the basic things to look for. And then any other things that you start feeling specific for your child, like I want to have more time with them, but I just don't feel connected. So those thoughts that start coming as well, those negative thoughts, those are some of the signs that you can start asking yourself, is this what's happening with me right now?
And we talked about getting some help if you didn't want to leave the house with our Care on Demand app. So what happens during a Care on Demand visit?
Well, it's on your phone.
On your phone.
It could be on your phone. It could be on your computer. And you get to choose the therapist that you want. There's a list of therapists there. So then you get to kind of scroll through it and see which one you like. You make an appointment, and it's like a regular appointment. You just have it on your phone. And then you talk about what's going on for you in the moment. So they're going to ask you what brought you here today, what made you seek counseling today, and then I'll talk a little bit about what is happening for you.
Great.
Yeah.
Great. So what can I do better to take care of my postpartum depression is the next question.
Sleep.
Sleep.
Sleep
Yeah.
and tell your doctor. Make sure that you get some support and get some sleep, and make sure you're eating healthy.
And like I said, just take some time for yourself. If you do that, if you take care of yourself, you're gonna take care of your baby and your family better. So I think that's the most important thing. Don't forget that you're also a person. You have needs. You need to sleep, you need to eat, and you need to have some relaxation time. You can't be focused on the baby 24/7. When the baby's sleeping, you should be sleeping, you should be eating, and you can have time to do the things you like to do. So I think that's the most important thing.
Definitely, and it's much easier said than done.
Right,
You know, and but it's so important. It's again that hindsight is always 20/20. But I think women just in general, it's very easy to just keep giving and giving and giving and get nothing in return. So.
For sure.
And speak up, ladies. I think that's too. We harbor a lot, and we think we should be doing everything. So I think just speaking out to a friend or your partner and just really being open and honest is really important.
Yeah.
Completely agree.
Yeah, we touched on a lot here. Do you have anything else you would like to add?
No, I think we covered all of it.
All of it?
Just making
Everything?
sure that you're speaking up, reaching out to your loved ones.
I guess one thing I did want to ask, and we touched on it a little bit, just treatment for postpartum depression. Is it strictly therapy? What are a few options that women have?
So we can go from therapy to medication to behavioral therapy and all this stuff. We can usually refer to a behavioral health professional, or if you feel comfortable as a OBGYN prescribing medication, you can start with an SSRI or any antidepressants. Again, you can start and taper off as the symptoms become better, or you can keep the patient on it for a year or 2 years. It depends if the depression becomes chronic. But therapy is obviously the way to start.
Therapy, I'd say some family sessions as well, because you want to get the family involved, make sure everybody's helping, and family members start to feel it too, so you want to make sure that they're taking care of themselves as well. And as in everything, having some therapy and some medication, a lot of times that's really what helps and speeds up the process.
And one person's journey and answer is not another person's journey and answer, so it's very individualized to the person.
I think that's very important, and that's part of the pressure in this world. Now that we have social media and all this stuff, and then you see all these happy moms, and you see everybody on Facebook posting happy pictures with their babies and stuff like that. You shouldn't compare yourself to anybody else. This is your journey as a mom, and all of our bodies are different. We all experience things differently, and the face these women are putting up on Facebook, whatever, might not be what they're really going through. So you have to think about that and just work on yourself and on feeling better and taking care of your family, okay?
Great. Well, with that, I think you said that perfectly. Dr. Salazar, Grace, thank you so much for joining us.
Thank you.
And once again, you can check out baptisthealth.net/support groups and download the Care on Demand app and use the 2 codes, Nursing Mama for lactation help and self-care for some of your mental health needs. Thank you guys. We'll see you soon.